My dear doctors, so today I am going to present the CMTD case in the neurology station. This is Charcot-Marie tooth disease, and this case is quite common in your neurology station. So again, in the neurology station, it's a short case, so you'll not be going to uh, take any history in this case. So thus there will be some prompt there. Normally it will be like examine the lower limbs, or maybe just do the general inspection and then proceed. So there will be some prompt there, but related to the neurology case. So let's move on. So how will you approach in a patient with CMTD or Charcot-Marie tooth disease? So first of all, once you enter the room, just greet the patient respectively and obtain their consent for the examination, and explain the examination process briefly and in understandable terms. Like something like this, you can say that I am one of the doctor working in the hospital. Is it okay if I examine your lower limbs or whatever is the prompt? And my examination will consist of uh, doing the general inspection, movements at your lower limb, and then checking for the sensations and checking for the reflexes. Once you have taken the consent, then you will move on and you're going to do the general inspection at rest. So just note any visible wasting, especially in the hands and feet. Observe the posture and look for any deformities such as pus cavus, which is high arches, or hammer toes. So here I have put the example of the pus cavus. So here you can see this is actually high arched, high arches on the feet, and this is something called the hammer toes. Okay. So, and once you greet the patient in the shake his hand, you will already note some wasting of the muscles of the hand. Here you can see there is some quite significant wasting of the hand muscles. So once you have done the good inspection, then you will be expected to do the focused neurological examination. I mentioned the cranial nerves here, but usually they are not affecting the Charcot-Marie tooth disease. However, you can examine it, but maybe in the end, if you have time. So for motor system is important. You look for the muscle bulk and tone. So look for any muscle wasting, particularly in the distal muscles of the limbs. You're going to assess the muscle tone, checking for any spasticity or rigidity. Then you will move on and you check the power, check for the strength testing, evaluate the muscle strength, especially in the distal muscles of the upper and lower limbs, and focus on key muscles which are involved in dorsiflexion, plantar flexion, and grip strength. And then we're going to check the reflexes. Test the tendon reflexes, knee jerk, ankle jerk, and normally we expect there to be hyporeflexia or areflexia. These are the common findings in the Charcot-Marie tooth disease. You're going to check the sensations as well, light touch and pinprick. So assess sensation in the distal part of the limb and look for any hyposthesia or anesthesia. Check for vibration, sensation, and proprioception as well. So we use a tuning fork at the toes and fingers and evaluate the proprioception by testing the patient ability to sense the position of the limbs. Here it depends on the prompt. If the prompt is to do the lower limb examination, you just do the lower limb examination only. You're going to check for the coordination. So test the upper limb or lower limb coordination, but by assessing fine motor finger skill. So for the upper limb, we can do the like finger tapping or picking up small object, and obviously you're going to observe for any ataxia or tremors. Finally, check for any gait and balance. Observe the gait. Ask the patient to walk. So noting any abnormalities in the gait, such as foot drop or typically in Charcot-Marie tooth disease, there will be foot drop and there will be typical high stepped gait. And look for the steppage gait pattern due to foot drop. Balance, well, perform the Romberg test to assess the balance. and patient with proprioceptive deficit, they may have difficulty maintaining balance with closed eyes. So this is the all about the examination. And once you done the examination, I put the differential diagnosis here for this case. Well, the cause of the weakness can be Guillain-Barré syndrome. We all know that it's an acute inflammatory demyelinating neuropathy that often presents with symmetrical muscle weakness. It presents similarly with areflexia and sensory disturbances. It usually follows an infection and can progress rapidly. But the differentiating point here will be Guillain-Barré syndrome is something which is quite acute, while Charcot-Marie-Toothism, you will observe the atrophy of the muscles, which will not be evident in the Guillain-Barré syndrome, although there will be muscle weakness, areflexia, and sensory disturbances. Peripheral neuropathies due to diabetic neuropathy. Now, patient with diabetes can develop the peripheral neuropathy, which can lead to muscle weakness, some sensory loss, and foot deformities. So, obviously, it is important to inquire about the history of diabetes. Well, here you're not allowed to take the history, but still in the diabetes also, normally such muscle atrophy will not be evident. Another differential diagnosis you think about is hereditary neuropathies other than Charcot-Marie-Tooth disease. So there are several other hereditary neuropathies such as hereditary sensory and autonomic neuropathy or other forms of hereditary motor neuropathy which could present with similar symptoms. And the differential is spinal muscular atrophy. Now, SMA is actually a genetic disorder and it is characterized by progressive muscle weakness and atrophy. It primarily affects the motor neurons in the spinal cord, so it can lead to muscle wasting. Muscular dystrophies, where certain types of muscular dystrophies such as limb girdle muscular dystrophy, it can present with muscle weakness and atrophy. These conditions are usually characterized by progressive muscle degeneration and weakness. Multifocal motor neuropathy, another differential, while it is a rare autoimmune disorder affecting the motor nerves and leading to weakness and muscle wasting, often in specific distribution. So it is characterized by asymmetric muscle weakness and usually responsive to immunomodulatory therapies. And finally, CIDP, chronic inflammatory demyelinating polyneuropathy. It is a chronic autoimmune neuropathy that causes progressive weakness and sensory impairment. So unlike Guillain-Barré syndrome, CIDP has a more gradual onset and persistent course. So while examining the patient, this is a case of polyneuropathy. So you should have these differential diagnoses in your mind. Now, how you will present the case? So again, I will divide it into, because this is a short case, neurology station, you only have 10 minutes. So there will be 6 minutes for you to do the examination and the 4 minutes for the patient to ask you, the examiner. In 4 minutes you have to present your case and the examiner will ask some relevant questions. So here will not be the same like we did previously in the consultation session, so it will be quite brief. So I divided into only 3 parts: introduction, examination findings, and summary. So introduction, say good morning, may I present Mrs. Smith, a 45-year-old woman. May I present a case of Mrs. Smith. So examination findings, and then after that you do, on examination, I observe there is muscle wasting, particularly in her hands and feet. Muscle strength is notably reduced, especially in the distal muscles. So just mention briefly the positive findings. Deep tendon reflexes such as knee and ankle jerks, they are diminished. Sensory examination revealed decreased light touch and vibration sensation in her distal limbs. Coordination testing showed mild difficulties in fine motor tasks, and her gait is notable for high-stepped foot drop pattern. So these are all the whatever you find the examination findings, you just have to mention them, and then you will summarize. So in summary, Mrs. Smith presents with the classic signs of Charcot-Marie-Tooth disease, which include muscle wasting, weakness, reduced reflexes, and sensory deficit. So these findings suggest a peripheral neuropathy, likely due to hereditary cause. Here you can say that, and then obviously you're going to think about the differential diagnosis and anything. Okay, so some of the questions which you may came across, the examiner may ask. So examiner may ask, what is Charcot-Marie-Tooth disease and what are its typical clinical features? So here is one of the answer. Charcot-Marie-Tooth disease, also known as hereditary motor and sensory neuropathy, is a group of inherited peripheral neuropathies, and it primarily affects the peripheral nerves, leading to muscle weakness and wasting, reduced tendon reflexes, and sensory loss. Patient often presents with foot deformities like pes cavus and a high step foot drop gait due to muscle weakness. Another question which examiner may ask is, can you elaborate on the inheritance pattern of Charcot-Marie-Tooth disease? So it is genetically heterogeneous. It can be inherited in autosomal dominant, autosomal recessive, or X-linked manner. And most cases but are autosomal dominant, meaning an affected individual has a 50% chance of passing the gene to their offspring. Okay. Now, another question which is quite common, they ask in this Charcot-Marie-Tooth disease is, what are the specific findings on nerve conduction studies in patients with Charcot-Marie-Tooth disease? So in nerve conduction studies, patients with Charcot-Marie-Tooth disease typically exhibit reduced nerve conduction velocities, particularly in the motor nerve. Additionally, there may be prolonged distal latencies and reduced compound muscle action potentials, indicating peripheral demyelination. Okay, so this is a quite common question they ask, so must be aware about what are the diagnoses which going to do for this patient, what are the further investigations you're going to do. So how would you manage a patient with potential Charcot-Marie-Tooth disease? So management is mainly supportive and focuses on physical therapy, orthopedic interventions for foot deformities, and assistive devices like braces or orthopedic shoes. Pain management and occupational therapy are essential components of care, and genetic counseling is important for affected individuals and their families to understand the inheritance pattern and potential risk. So only 3 points you should remember in the management. First, it is supportive. So mainly it consists of physical therapy, and we need some interventions from the orthopedics, for the foot deformities, we need the assisted devices, and pain management and occupational therapy are essential component, and genetic counseling. So are there any specific genetic tests available for diagnosing Charcot-Marie disease? Yes, there are genetic tests including DNA sequencing, which is available for diagnosing the Charcot-Marie-Tooth disease. And these tests can identify specific mutations associated with the disease and will confirm the diagnosis, especially in cases where the clinical presentation is ambiguous. So these are the questions which the examiner may ask you. Anyhow, these are only the examples. Obviously, my idea is to just give you some food for thoughts. So hopefully it will help you. Thank you very much, and I'll see you in my next presentation.